Dr. Motsoaledi says South Africa is going to bounce back from aid cuts by the United States, but he says the United States funding cuts would have an impact on the country's HIV/AIDS program. US President Donald Trump earlier this year signed an executive order aimed at freezing assistance to South Africa over what he described as a controversial law that allows the government to seize farmland from white farmers without compensation. Motsoaledi is in Port Shepstone in KwaZulu-Natal, where he will be commemorating World TB Day. He's reiterated his statement that more people die from tuberculosis than a multitude of well-known diseases combined. He says Ebola, malaria, yellow fever, the bubonic plague that nearly wiped out 1/3 of Europe, smallpox, HIV and AIDS, COVID-19, influenza and mpox, and put them together, TB has killed more people than all of them. But still, nobody is scared of it. Motsoaledi says government is launching a program to test 5 million people annually. He noted that early detection and treatment will reduce deaths.
We are extremely serious, extremely so. That's why you see us standing up. Fortunately, I'm not only talking for South Africa. In 2013, I was elected to be the chairperson of the International Board of Stop TB Partnership because the World Health Organization and United Nations established a body called Stop TB, which is based in Geneva. I was chairing it. And all this information about what's happening about TB in the world, we know about it is worrisome. And why is it worrisome? This is a centuries-old disease. It's a disease that was was found by Robert Koch in 1882. 1882, you can imagine how many years back. But it's still giving us a tough time. Number one, it's the biggest killer of all infectious disease. Yesterday I mentioned something, even last week with journalists, and they thought I was lying. If you take diseases like cholera, Ebola, bubonic plague, HIV AIDS itself, yellow fever, malaria, influenza, COVID-19, add all those together, all of them add them. TB has killed more people than them. All of them added together. But those diseases make people run around, they scare them, and they are very active. TB, no. It's not, so it worries us. In fact, in this meeting in 2013, which was in the Seattle in USA, they actually called brand expert and marketing expert and say, can you use your expertise to teach us? How do we energize the community about TB? They are energized about all these other diseases, but not TB, when actually it's #1 killer. I must tell you it was a difficult thing because I don't remember us getting a good answer. But the small answer we have is that, as I always said, the problem is TB is that it's not a drama queen. It doesn't announce itself with drums and majorettes when it comes. It comes very silently, but kills very effectively. And people die after a long time in isolated areas. Like our calculation is that TB kills 10 people every hour in our country. But they die in separate areas very silently. Nobody can see it.
Well, for more on this story, let's cross now to my colleague Nonhlakanipho Magwaza, who was following that story for us. A very good afternoon to you, Nonhlakanipho. The minister there painting a very dire picture about how very dangerous TB is. Tell us more.
Good afternoon, Nompo, and to the viewers at home. Yes, we did have the opportunity to doorstop the Minister of Health, Dr. Motsoaledi. He did say that they are working on decreasing the amount of death or the number of deaths that were still on the rise here in South Africa. They did say that they have made progress in decreasing the number of people who are infected, but by 57%, but the number of deaths is still high. He did say that they are here at Kamalake in the Ugu district to launch a campaign that they are targeting 5 million people that will be screened, tested, as well as put on medication in a year's time. So it's 5 million per year that they are targeting around South Africa in order to fight this disease. It did also say that they are very concerned that this is a very long disease. It's been around for a very long time, but they are still facing a high number of people who are dying from this disease that is preventable and curable. We did when we got here speak to a couple of community members about TB. They admitted that they do go to annual checkups, but they don't check up for TB. They only check up for your diabetes, your AIDS, and so forth and so on. But they don't screen or test for TB because they feel that they don't have TB because they don't have the symptoms. And Motsoaledi did say that that is their biggest problem, because people come to clinics very late when they are developing, when they've already developed the symptoms, and sometimes it's very late to start treatment for them. And the biggest problem that they are facing is those who are defaulting in medication, when people think that they are now cured after about 6 weeks, because the treatment is about 3 months, and just because the symptoms have gone away, they think that they have been cured, and then another strain of TB will then arise from that. And he did say that that is their biggest concern. However, the program has just started. The minister and deputy president just arrived with the provincial counterparts, MEC Nomagugu, as well as the premier of KZN, where they will be launching this campaign here at Ugu District. Back to you in studio, Nombu.
All right, thank you so much. My colleague there, Nonhlakanipo Magwaza.